Hi, my name is Kelly. I'm going to provide privacy, do some hand hygiene. So we have some orders today to do from your doctor to insert a Foley catheter because you are retaining some urine. So can I go ahead and get your name and date of birth, please? Perfect. Alrighty, so what I'm going to do is I'm going to go ahead and uncover you, roll your sheets all the way down to the feet of the bed, and then we're going to put your legs in a butterfly position to help expose your genitalia area, okay? So what I'm going to do is I'm going to go ahead and expose you, is that okay? And pull up your gown, and I'm going to go ahead and get everything set up, okay? So first I'm going to open away from me, and then the side to side. Being careful not to touch anything but the 1-inch border. And then I'm going to grab the corner of the blue sheet, the blue sterile sheet. Being careful also not to touch anything but the 1-inch. And then I'm going to drop it between the legs. We'll have more room. And then I'm also going to turn this, being careful just to touch the edges to the side. And then I'm going to put on my sterile gloves, but I don't have any room over here, so I'm going to do it over here. So you're going to be careful not to touch your sterile field here or here. You're going to only touch the 1-inch borders. Alright, so now I'm going to move my box to the side so that I have just a little bit more room. This is for a male and we don't need it, so we're going to throw it away. We're going to move this over and we're going to set up our swabs. We don't need the urine collection kit, so we're getting rid of that. We're going to put our lube in the corner. Lube, 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 lube. And then we're going to set up our syringe with our water, hook it up to our catheter. Alrighty, and then I'm going to go ahead and uncover this, making sure to wrap it around my finger so that it doesn't touch anything outside of our sterile field. Put that all back in the box. Move our box over in front of the patient, in between the patient's legs, like so. Alright, and then I'm going to go ahead and make this hand dirty, my non-dominant hand, and open the labia. If this was a male, we'd pull back the foreskin, and then we're going to use one at a time. That didn't happen. One at a time to clean it. So we're going to go outside. And normally your trash can's over here. Mine's over here today. Over there. One on the inside, over there. And one down the middle. If this was a male, we'd go 3 times circularly around the head of the penis. Then one down the middle. And then this one is done, so we get rid of that. Making sure not to cover back over your sterile field. Then you're going to take the end of the catheter, put it in the lube. And then you're going to say, okay, you're going to feel a little bit of pressure. I'm going to go ahead and have you bear down, okay? And then you're going to insert until you see urine. You're going to go an extra 1 to 2 inches. And then you're going to hold on to the catheter with your dirty hand and fill it up. Mine isn't going to go too much because I don't have that much room. Okay, and then once you do that, you're going to come down and take the syringe off. Get rid of that, and then you're going to do a little tug, see if it comes out. It doesn't come out. So then you're going to take your catheter out and tape it to the leg of the patient, and then drop this to the stable edge of the bed and hook it there. And then just lay it there. Then you Get rid of everything. And you're done. And then you can take off your gloves. And then 24 hours has gone by. We have new orders. So we come back in, knock knock, do some more hand hygiene, provide more privacy, tell the patient we got new orders, you're no longer retaining any urine, so we are going to go ahead and take that Foley catheter out, okay? So then we put on new gloves. They don't have to be sterile this time. I'm gonna use mine because I don't have any others. All right. So then we are going to get a towel. I'm gonna use my blue one just because I don't have anything else. Towel, place it back between the legs just to keep everything dry. We're gonna get a new syringe or the old syringe, it's not sterile anymore, and go ahead and deflate that balloon. Make sure we got all of it. And then this is gonna feel a little bit of discomfort, so I'm gonna go ahead and pull this out and go ahead and take a deep breath for me and hold on to it. And we're gonna pull it out, inspect the tip, make sure there's nothing funky on it, no blood or anything, and then we're gonna go ahead and wrap it up. Untape it, pick up the urine bag, and throw it all away. And then that's it.